Accountability to Affected Populations. Part 2. Accountability in the Program Cycle. On completing this part, you will be able to identify opportunities to integrate accountability to affected populations throughout the program cycle. Now you know what accountability to affected populations is and why it is important. This learning element will present examples of how to integrate accountable and inclusive activities in your work. Needs assessments. Ensure accountability to affected populations related questions are included in the Interagency Rapid Needs Assessment. Ensure humanitarian needs overview processes integrate accountability to affected populations considerations. Assess potential sexual exploitation and abuse risks and identify mitigation measures. Integrate accountability to affected populations' actions in response appeals and sector or cluster plans. Ensure humanitarian response plan processes and midterm reviews integrate accountability to affected populations approaches. Meaningfully engage affected populations on project design, the design of feedback and complaints mechanisms, and the geographic location of service delivery points and distribution locations and strategies. Budget for accountability to affected populations activities, including training, staffing, and operations expenses. Incorporate accountability to affected populations related outputs and indicators in project results frameworks. Involve people affected by an emergency in project implementation. Make sure affected populations have the opportunity to provide feedback, register complaints, and get a response. Share timely, actionable, and potentially life-saving information with communities quickly and efficiently. Circulate prevention of sexual exploitation and abuse code of conduct and remind all staff of their obligation. Involve affected populations in monitoring, after-action reviews, and evaluations. Share your findings with communities and partners. Ensure the feedback collected is analysed, presented, and reviewed to inform project adaptation on a regular basis. Advocate for and support the integration of accountability to affected populations into sexual and reproductive health and gender-based violence subsectors, clusters, and working groups. Ensure and support all cluster members to have codes of conduct in place. Work with government ministries and service providers, including gender-based violence subclusters, to integrate referral pathways for assistance and support with PSEA complaint channels. Accountability to affected populations is everyone's responsibility. For additional information and guidance on each of these activities, please refer to the Accountability to Affected Populations Operational Guideline